Hey everyone, welcome back to Better Way by RoJo. Welcome back again to the healthcare section of the site. I'm super excited because I'm down in Vancouver for the Pacific Dental Conference, and I managed to run into some pretty awesome people, so we're going to shoot some interviews, give you a different take on a related concept. So this is Vera. She is a certified oro-facial myologist.
I am.
And so take it away, Vera.
Well, I'm a certified oro-facial myologist. I began my training because I had two children. My first daughter was diagnosed with a little bit of a lisp, and our son had a severe lisp. When our daughter was in kindergarten, the speech-language pathologist that assessed her said, oh, you know what, her lisp isn't too bad, and she's going to outgrow it. And I'm like, that's perfect, right? 3 years later, our son sounds like this, right? So the SLP, who was different, says, you know what, speech-language pathology isn't going to be enough. He's going to need myofunctional therapy. And I'm trained as a Saskatchewan dental therapist and a registered dental hygienist, and I didn't know that there was a thing called myofunctional therapy. So I'm like, what? And they said myofunctional therapy. And I'm like, so tell me what that is. Well, your son's not resting his lips correctly, and he's not swallowing in the right direction, and he's compensating with his orofacial muscles. And I'm like, so tell me what we should be doing. And I'm dentally trained with 2 dental diplomas. And I'm thinking, okay, I'm going to learn a lot. So yeah, she basically went into the fact that the lips should be closed at rest. The tongue should be resting up at the top of the roof of the mouth. It should not be touching the teeth. And I was just blown away. So I said, you know, would you mind maybe reassessing our daughter? Because she's now 3 years older, and guess what? She didn't outgrow any lisp. And so she had a look at our daughter and said, oh yeah, she's certainly, you know, not using her correct musculature. How about we refer her to, because she's no longer available to seek treatment in the school system, how about we refer her to a private speech-language pathologist? So off with my daughter I go to a private speech-language pathologist at $100 an hour, and the SLP worked with us, taught me and my daughter what kind of exercises that we need to do, educated us on where the lips should rest, how the tongue should rest, because I didn't know any of that, and then through week to week, through exercises, we went back to see her. And I was able to seek treatment with her for about 2.5 months. And after 2.5 months, she said to us, you know what, we're making minor progress. What I want you to do is I'd like to refer you to an orthotropic dentist. His name is Dr. Benny Eastwood. He works in downtown Edmonton. And he's gonna help you, or you know, he'll determine whether or not your daughter's palate is already too narrow to accommodate her full tongue to rest within the palate. I'm dentally trained. I'm thinking to myself, okay, I'm gonna go listen to this.
What year is this?
This is back in 2005.
Okay.
2005. So 2005, I take my daughter in to go and see Dr. Eastwood, and I'm a mom. She's in the chair. I'm sitting at the foot of the chair. Dr. Eastwood walks into the room, and he says, oh yeah, you know, pleased to meet you, but he's looking at her. He's like, she's way too narrow. I'm like, skeptic, right? Maybe you're gonna measure her first, right? And he's like, yeah, I'm gonna measure her. Absolutely, I'm gonna measure her, but I don't need to, because it's written all over her face, how she's developed. She doesn't have an ounce of fat on her, but she's really cheeky, right? She's using, watch when she swallows. Watch her lips. Her lower lip is bigger than her upper lip. She's compensating with her orofacial muscles when she swallows. Yeah, she's definitely too narrow. And I'm like, wow. Okay, and so he starts measuring her, and yeah, she's, you know, her intramolar width, I believe, was in the low 30 millimeter range. He wants it, you know, mid to high 30s, like closer to 40 millimeter would be great. And so, so I agreed. It totally made sense to me that, okay, we're gonna start with this full process. So we started expansion, and he was telling me that there happened to be an IAFGG in September of 2005 in Edmonton So I took some time off my dental hygiene work and I went to the IAFGG, and I happened to meet Barbara Green and Joy Moeller. And Barbara Green and Joy were going to be teaching a course in myofunctional therapy starting in January in California. And so I ended up talking to my husband. I said, you know what, $100 an hour times 2 kids, we need it, right? So he's like, do whatever you want, right? He's an engineer. He's like, this is your area of expertise. I've got my area of expertise. Off you go. So I went off to California, and University of Southern California is where I actually was taking the course with Joy and more with Barbara. And Joy taught us on how to teach, or how to develop a business. And then from there, and Lecha Pasquet was there as well. I took the course with the intention that I was going to go back home and just train my kids, and that was going to be it. And so I went back home, and both our daughter was expanded, and our son, then I had Ben assess him, and he needed expansion as well. So he ended up getting expanded as well. Both kids have been stabilized completely through all of their normal growth and development. The arches are in. They've got the function to complement the artificial form that had been created through Ben, and we've got optimal stabilization with no artificial retainers. So when the SLPs at school found out that I actually took this IOM approved training, then they were like, Vera, we happen to have some patients that we need some help. Would you mind seeing a patient, right? So I started, I'm like, I don't know. Like, you can do this, you can do this. I'm like, I just did my own kids, right? So I took the one patient on, and this patient was 5 years old, and he was referred not just through the speech language pathologist. When I did his before and after pictures, because the IOM wants you to take before and after pictures dentally, and I just took a front resting shot, his midlines were way off, and he was in posterior crossbite on the left-hand side. And so I worked with him with therapy, and he was a little trooper. And by the time we finished, we started him in the fall, and we finished him, I believe, February or March, just a few months later. And his midlines weren't perfect, but they almost were perfect, and he was out of posterior crossbite. That was my first patient other than my kids, and I'm like, oh my God.
With no orthodontics?
With no orthodontics, just working on the musculature. Yeah, so I looked at the musculature, determined which muscles were weak, which ones were too strong, and lips were open at rest. We need to get the lips closed at rest. We need to get the tongue resting up on the palate. We need to actually increase the tongue toning from the front to the middle to the back. We need to bring in the sides so the whole tongue fits within the palate, in the arch. And when doing that, then we have to actually maintain the space for the whole tongue to actually fit inside the palate, so that it doesn't actually sit on the chewing surfaces, on the occlusal surfaces of those teeth. So over the years, then I've been able to take other kids in more cases than I've actually been documenting. So doing dental hygiene still in the part-time. I was working for this dentist in Sherwood Park who had been almost ready to retire, and number of patients are young patients coming through my dental hygiene chair that obviously have the same myofunctional problems as my kids have. And so, I mentioned something to the mums and to the kids, right? You need to keep your lips closed. You need to keep your lips closed. Well, there's one kid that comes through my chair, and the kid is 18 years old. And this kid is scheduled for surgeries the next week or within 2 weeks or something. They're going to break his upper jaw, they're going to break his lower jaw, they're going to scoop out a bunch of bone, they're going to bring his lower jaw back, and they're going to cement him shut. And he's only...
They're going to bring it back.
Yeah, and he's end to end, right? Because that was a recommendation from the dentist that I was working for, that you need to see this oral surgeon. And I'm like, no, please, right? How about, I'm just saying maybe we can try to see if I can, coach you through some exercises. I'm not going to guarantee you anything, but before you do the surgery, you can always postpone the surgery and reschedule it if you'd like, but maybe we can actually try to do some exercises. And so the kid is like 18 and his mom's not with him. So he goes home and he's pretty excited about this because maybe he might not need to do surgery. He doesn't want, I don't know why, right? So he goes home and he talks to his mom. And his mom phones our office, and talks to our dentist. And the dentist had made this recommendation, right? And so the next thing I know, I'm hauled into the office, right? And the dentist tells me, by the way, I'm the dentist. I have the doctorate. You have nothing. Yeah. So here's the deal. You need to keep, I'll make the recommendations and you nod your head, is what he said. That's were his words. And I'm like, yes, sir, I say. And he said, yeah, your mouth is saying something and your body language is telling me something else. And I'm like, you just told me what I'm supposed to do. I have no credentials. You have the credentials. Yes, sir. And I thought to myself, right then and there, I'm going to get me some credentials and I'm going to show you. We're going to go. Yeah, we're going to play some ball here. So I ended up, right after that, I applied for the certification exam. There's a written exam with the IAOM. It's a 6-month written. I wrote, my written exam was 138 pages referenced. And I did very well on that. And then I completed my practical exam in March of 2009, completed my certification exam, became the first Canadian to be internationally certified with the IOM. And I've been doing it ever since. And the results and what I've been doing since then, because they just wanted before and after pictures, that's not enough for me, because I need to keep these patients engaged. We're giving them therapy, we're getting them to do exercises, and people get burnt out. They want to see progress, and so we need to keep them motivated. So they need to be fun, so we've made games out of them, and they need to see progress. And so with what I've done is I've been able to be the functional detective to figure out which muscles are weak, which ones are too strong, and then from there develop programs individually for my patients, and then document through pictures, actually what's happening through the arches. We've had medical experts that have come to some of our conferences earlier on that say, we medical experts will say that the tongue will never remold the palate. And I have documented pictures of situations, patients, where the tongue has completely remolded the palates. I've seen amazing stuff. So 3-year-olds that you can't even, the parent actually had to translate every word because the tongue's resting there all the time. So every word, you can't understand what the kid is saying. Anterior open bite, gastrointestinal issues, already, growing with a longer face, so vertical facial growth that's occurring. I gave that patient, that mother, I did some nasal testing, make sure that the kid was able to breathe through the nose, no problem. So once we achieved that, then I gave him 3 different tips. Put a bread clip between your lips. Hold your bread clip when the kid's watching TV or coloring, any downtime. Keep those lips together, number 1. Number 2, take a button, put it vertical between your teeth and your lips. Pull this button and do some little tug-of-wars to increase the lip strength, to keep those lips closed. And now what we're going to do is we're going to start clicking and popping. This kid came back with those 3 tips 9 months later, and the anterior open bite, which was open about 5 millimeters, was almost completely closed, and the face had complete horizontal growth. Didn't even look like the same kid. And then since then, I've seen just amazing cases that orthodontics, this kid was in orthodontics for 7 years. They couldn't close the left side of the bite, right? The right side was beautifully interdigitated, left side was completely open. Kid was sleeping on her left side, tongue hanging between her teeth, we educated in terms of sleeping patterns. She had a lower jaw shift. We stabilized the lower jaw. Amazing things happened. That one took a long time, but she's completely interdigitated, right side, left side. Her diastema that actually grew crazy amounts through the therapy on its own with no appliances, then closed as the left side interdigitated. It's just been a gift. So I'm very thankful to my dentist who actually challenged me to get the certification. It's been a gift because I've been able to treat my own kids. Our daughter, who was never going to be like mommy, is actually just found out 2 weeks ago that she's been accepted into the U of A, into the Master's Speech and Language Pathology program. Awesome. And she is going to be doing myofunctional therapy after she graduates. That's her goal.
Because do you still have to be either a hygienist or an SLP before you can become a...
Yes, yeah, you need a degree-based background, yeah, before they'll actually accept you in the IAOM for the initial 28-hour training.
Yeah, that's really cool. Like I just went to Tom's course all day today, which I'm going to shoot a different video about later, but I was blown away by how much of a difference you can, like I've always felt like, you know, once your face is actually messed up, then you got to do something about that first, right? You got to use, you know, expansion appliances or
we need room. Forward, we need room for the tongue to actually fit.
But it was crazy how much healthier people could get with a super conservative treatment, right? Just
this is exercise.
Keeping your mouth closed and keeping your tongue in the roof of your mouth. And
actually teaching people what proper function should be. You know, we spend thousands of dollars trying to treat symptoms. How about we look what's the problem in the first place? Yeah. So we've got the triangle of life here, right? Or they call it the triangle of death, but let's go with the triangle of life. Because if we actually look at this and determine what's wrong, and then try and make a difference to figure out how we can, you know, turn it to the right way in a less invasive way. We're talking about exercises. I'm not using any appliances. I'm giving them fun games to do with their mouth and their face.
So is there, I should know this, but I don't, is there a, because the whole point of this is to try to get people to be able to get better care for their children, right?
Right.
Is there somewhere people can go to find registered or certified?
Yeah, if they go to the IAOM website into the directory, then they can actually, they can search it by name if they know the name of a practitioner or a therapist, or they can actually go search it by area. So if you have a city or a province or state or whatever, depending where you are in the world, right, you can actually certify it because we are an international nonprofit organization. Yeah,
that's a good point. So, because my understanding, and maybe I'm wrong about this, is that Brazil, there's a lot of stuff going on in Brazil, that Brazil's kind of like the leading place on earth for this, right?
Because in Brazil, you actually need myofunctional therapy for everything. It's foundational for medicine, it's foundational for speech, it's foundational for dentistry, right? They don't actually, they won't start with anything. In every other country, yeah, they're trying to catch up. Now the US is better than Canada. The lady that's certified, or that Barbara Green, right, that taught me more than as much as I know, that she's amazing, and continues to mentor me because I met with her again this year. She had been certified for over 30 years, and I was the first Canadian to get certified. That's crazy, right? That doesn't make any kind of sense. So yeah, it's been a gift to have, you know,
how many are there in Canada now, do you know?
Certified?
Yeah.
Oh goodness, I can't actually say. I'm going to guess less than 5, though. 5 or less. Yeah. So no, we don't have too many that are certified. Okay. 1, 2, 3. Yeah, me. Or maybe between 5 and 10. There's not more than 10 for sure. Not more than 10 for sure certified. But we have many others that are working on their certification right now.
Okay, cool.
Yeah. And now I'm on the International Board of Examiners. So now I spend my extra time helping to grade the written exams and supervise a practical exam to actually increase the potential for more qualified practitioners to be doing this within our country, that's for sure. Yeah. So they have the proper credentials, they're following proper protocol. Yeah, so it's been a gift.
Yeah, that's really cool because this is the whole You know, I've always been saying all along that if I actually succeed in what I'm trying to do here, which is to get people to understand these deficiencies and try to find somebody that can actually help correct these problems, it's going to create a massive supply and demand problem.
Absolutely.
Because
Yeah.
there's so few people that are
Absolutely, that are
doing this,
really,
so.
really well qualified to do it. Yeah, so the IOM is amazing that way, because now, and I've been doing lots of presentations. Because I was challenged, now I really want to get the word out. So in 2012, I wrote the CRDHA, our College of Registered Dental Hygienists of Alberta, actually featured me on the front page of our newsletter, or our glossy magazine. And I wrote an article with some before and after pictures. And I'd asked some of the hygienists, we're in a big office at the time, there was 8 hygienists. I'm like, you know, after you're done with your, you know, newsletter, just bring it into the office, because I'm going to take it home and I'm going to kind of, you know, give it to my family, right? So they brought in all these newsletters into my office with the same dentist, right? And so get a flood of these with my face on the front picture with this patient. And my dentist ended up reading it, and he said, Vera, this is groundbreaking stuff. Yeah.
Well, at least he admitted that. That's
Yeah,
pretty good.
he did. Yeah. So I'm like, thank you.
So is there a, do you have like a website or anywhere that people could, like, so say there's a mom out there that sees this video somehow, miraculously,
Right.
and says, I need to get this done for my child, but there's no one around, but they know a hygienist or a speech language pathologist. Like, where should they point them?
www.iaom.com, and go and look into the directory. Yeah.
No, but I'm saying if they want to get, like, okay, I'm mom, whatever,
Okay.
I've been going to this dental office, and there's a hygienist there,
Right.
and I want to talk to her about oro-facial myology.
Oro-facial
And it's like,
myology.
they're going to be like you were back in the day and say, I've never heard of this before. So
Right.
where should that hygienist go to get
Well,
more info? And
if they go to IOM, or they can actually just contact me. So if they go to functionfocused@shaw.ca,
okay.
yeah, I can certainly help and answer all questions. I do it all the time.
So anything else? Anything else you want to add?
I'm just blessed to be able to do it. Yeah, I'm helping a lot of people. I had no idea that my career was going to go this way. I love doing the presentations. I presented here at the PDC 2 years ago at the So You Think You Can Speak. The top 4 presenters get invited back to present for 2.5 hours. I was selected last year. This PDC I've been walking through, and people are like, "Are you presenting? Are you presenting? I want to see it. I want to hear it again." Yeah, yeah. So
yeah. So hopefully
we've
they have you back next year.
been able to spike some interest. That's where we want to go, and I'm not going to stop anytime soon either.
Awesome. Perfect.
Yeah. So thank you for.
Yeah. No. Thank you. Thanks for doing this. So
Yeah.
So yeah, like I always say, it's the whole point of this Better Way by RoJo project is to try to help parents help their children grow up healthier, smarter, better looking, happier, and more successful. And
That's awesome.
I've obviously heard about OMT and stuff over the course of everything I've been doing, but I've never taken any courses myself. I don't know a whole ton about it, and it's crazy how foundational and powerful that is. So
It is foundational.
So yeah, it's really awesome. So
Yeah. Thank you.
like I always say, if you have any questions, we're gonna post Vera's email, or you can contact me at betterwaybyrojo@gmail.com, or check me out on Facebook, because I believe that there's a better way and that we can create it together. So thanks again. Thank you again.
Thank you.
Bye for now.
Bye.